Now you can, I think so. I hope so. Because we were able to do it before. Okay, let me get started on recording. Okay, we've got another person coming in. All right, hello there. All right, we got Miss Mary coming in. Oh, there's Mary showing herself. Okay, cool. Let's admit a couple more people here. Perfect. Those of you who just joined us, at the top right corner on the gallery view, you can click on that if you want to see all the squares, or click it again and then it'll just show me up there. Okay. All right, let's get started. I'm going to share my screen so we can go over the presentation. And again, as you have questions, just add it in the chat box. I'm going to be asking questions like how many people have done this. So just if you can comment in the chat box, that'll help me know that you're there, and we'll have some reciprocation because I'm used to doing this live. So I'm used to getting, you know, feedback from everybody. So that would be helpful and I would appreciate that. Okay. Okay. So let's start here. All right, do you have postural dysfunction? Okay, so my name is Beth, and I've been a physical therapist for 25 years. Started Magnolia Physical Therapy. Lisa Taglauer and I opened it up in 2005. And we have 4 locations: West Bank, Marigny, Uptown, and Elmwood. So what I wanted to get from everyone is, write in the comments section, if you can, what's been going on with your neck, shoulder, or back since working from home, quarantine, or just in general. Is it neck pain? Is it radiating pain down your arm? Just so I get an idea of who our audience is, and I can kind of shift and focus it to that. All right, let's get Nicole in. Okay. All right, hang tight. I'm gonna change my slide. Here we go. All right. So let's see, you guys add in your comments here. Okay, perfect. Let's see, we've got neck pain with tingling fingers from Mary. Oh, that's not good. Yuck. Okay, sciatica possibly. That's Cox. Okay, good. Let's see, lower back pain, back and hips, neck pain, leg pain, sciatica. Yoga poses help. Yes, definitely. Back and hips. Okay. All right, thank you for that. I appreciate that. Okay, so postural dysfunction. What is postural dysfunction? So what we do at Magnolia Physical Therapy, obviously, I know some of you might be past patients. Some of you might have not heard of us before or heard of physical therapy. So I just wanted to go into that. So Magnolia, we work with some of the largest employers in the city to prevent postural dysfunction so we analyze their workspaces for ideal alignment. And then when they do end up getting pain or dysfunction, we treat their staff so that they can get better. So we'll work on them in the clinic, you know, when the pain isn't as bad, so that it doesn't lead to something like a work injury or something like that. So we've been working a lot with those companies. So we've been seeing a lot of postural dysfunction lately. Okay, so I know myself, I was working from home probably about 3 weeks at my kitchen table, and then it dawned on me. I'm like, oh, my hips are killing me, my neck is hurting, and I realized that I'm sitting at a kitchen table chair. I don't have my ergonomic chair like I do at work. I have my laptop, which usually at work I'll have it set up at the right height and all of that. So once I altered that, I felt a lot better. So there are 3 ways to handle your pain, and we all know the first one, right? Ignore it. So you guys that are on this call, this is not the category you're in, or else you would not be here, right? So ignoring it, you probably may have ignored it in the past. So what does ignoring it do? Right? Write in the comments section. For me, when I ignore it, it just gets worse, which is not good. So that's not a viable option. The second way to handle it is to alter it. So we're going to talk about some things to alter your pain. There's an old way and then there's a new way. So things that we can alter it would be changing our posture at our work desk, working in different various heights, things like that. So we'll go over that. And then the third way is to handle it. So that's where we come in as physical therapists. So, some people, if their posture is so bad, it's hard for them to get in proper alignment, right? If you're sitting at your desk like this, and then how many of you have ever done this? You're sitting at your desk and you're like, oh, I need to work on my posture and get it better. And then you start working, and a minute later, you're right in the same spot again. So your brain doesn't really have the capacity to hold you in that position because the muscles aren't taking you there. So that's where we come in. We come in and we look at, analyze your, how things are moving, your joints, your muscles, and we go in and we fix that. All right, so these are common impaired postures. So this girl is pretty bad here with her forward neck posture. This is someone standing up, obviously. But we have curves in our spine for a reason. So when we sit or stand or move, the curvatures in our spine allow us to bear weight and bear load properly so that we don't get abnormal stress on our joints, our spine, our muscles. When we have poor posture, mainly what we're talking about is postural dysfunction, sitting at your desk, from working from home, quarantine. What happens is your kyphosis, which is this curve here, gets greater. And then when you slump, your neck and your head automatically do this. So what I want everyone to try here, okay, so I want you to get in a position where you're slumped forward, whether you're sitting or standing. And I want you to slump forward, and I want you to bite down like you're gonna take a bite to eat. And then I want you to sit up in a nice position where your chin is tucked in and bite again. And do that a couple times and feel the difference. So by just changing your posture just slightly can affect, your jaw. That's just one example. But when you're slumping forward too, what's happening is all of the muscles in the back of your neck here are getting tight, which could be pinching that occipital nerve, which could give you headaches. When you're slumped too, it puts your lumbar here flat. Your lumbar curves should be curved. So, we'll also talk about that, the proper sitting posture. So you want to make sure that you have something behind your back to keep that natural curve in your spine, or you're going to get abnormal wear and tear. Okay, so a little history about sitting. Sitting is the new smoking. The average American sits for an average of 7 hours a day, making up 55% of our waking hours. That is crazy. So combine this with sleeping, and that's a whopping 15 hours of sedentary activity a day. That is a lot. So, even just when I've been working at home, even just from staying at my desk, my kitchen is 5 feet away, right? The bathroom is 8 feet away. At least, I don't know if you guys have noticed an increase in weight gain since the quarantine. Let me get a show of hands or a quick yes in the chat box. Yep. So what's happening is, well, two things. It's easier to snack, right? Because your kitchen is right there. But we're not doing the smallest little bit of walking that we normally do at work. So even from your house to your car to the clinic or your office, walking from your office to the bathroom, or your office to the boardroom or the meeting room where you are. So those little things can add up, and it really makes a big difference. So they have found incredibly strong evidence that links poor posture and prolonged sitting to poor health. So 112% higher risk of diabetes, 145% higher risk of cardiovascular disease, 47% more likely to suffer from depression. So those are pretty alarming. So we need to do something to fix it, right? So obviously, a lot of us have to work. We can't change our occupations for this, but there are strategies that we can do that can prevent this postural and sitting issue. Okay, so some of the other things prolonged poor posture can lead to: neck pain, and we talked about that, neck pain, headaches, TMJ, which is jaw pain, upper extremity radiculopathy, or pain radiating down your arms, shoulder pain, impingement, carpal tunnel, impaired function of the diaphragm, because if you're slumped forward, your diaphragm can't expand and you can't utilize the diaphragm to breathe as you want, so your ribs actually can get restricted. Low back pain, pain radiating down the legs, and hip pain. So I noticed in the comments when you guys had pain, you listed most of these. Okay, so this is what we can do to alter it. So I don't know where you guys are right now, if you're sitting at your desk or if you're on the couch. But if you're at your desk, whether it's at home or in your office, what I want you to do is look around and see how things are positioned. So you see this, this lovely lady right here has very good posture. So what you want to do is look at how your knees and your ankles and hips are aligned. So the rule of thumb is 90, 90, 90. So a 90, like a perfect L here at the hips and at the knees and at the ankles. So you don't need a fancy ergonomic chair or fancy equipment or furniture to get this done. So at home, I have a couple of, we don't have phone books anymore. That's what I used to tell people to get, is use the phone book. But I have a couple of coffee table books that are pretty thick. So I take 2 or 3 of those and I put my laptop on that. Then I also got a wireless keyboard so that I can keep my vision right here at the top 1/3 of the screen. So look at your workspace right now and just, jot down or keep a mental note of some things that you can change to modify this, because that's going to make a big difference. Even just your keyboard being at eye level as opposed to forward. When your head is forward, these muscles have to work awfully hard. And you think about 7 hours a day, right? So what does the little kid on Jerry Maguire say? The human head weighs 8 pounds. So we have this 8-pound bowling ball on top of our heads, right? All day long when we're sitting. If we had a shoulder injury, we wouldn't walk around with a briefcase out here all day long, right? That's crazy. So we have to give it different input, and we have to make sure that it's in good, proper alignment. So making sure the top 1/3 of your screen is at eyesight level. Again, with your elbow, you want that to be at a 90-degree angle as well. So what I did at home too is it looks like she has kind of one of those old like a little step stool or something. I have yoga blocks that I use at my home office. So again, it could be a couple of books or, of course you can go online and buy things if you want. But what I'm saying is it doesn't have to be expensive for it to help in things. Okay. Use lumbar pillow if desired or comfortable. So that's to help maintain this lumbar curve right here. A lot of times, especially like my home office chair stinks. So I went and got mine from work and brought it home to give a nice lumbar support here, because if you're slumped forward there, that's going to cause that whole forward head posture there. Okay, and then do not work from the couch for several reasons, but the main one is for posture. So you're here, you're kind of slumped back, and you're working on your keyboard. It's just it's not good for our joints. It's not good for our mental state either, because when we're on the couch, our brain says work's done, right? Where's the cocktail at 5 o'clock? Okay, so that's one way that we can alter our posture. Another way that we can alter it is get moving. So this is a really, really important part. So make sure you guys are listening to this, okay? This has helped me tremendously, has helped a ton of my patients, my staff, taking breaks. Okay, so it's not always about the furniture. In fact, if you have poor posture, the movement dysfunction needs to be addressed before the ergonomics is. So if the back of your neck is so tight, you're not going to be able to get into this position because the muscles are so tight here. So what I suggest is getting up and moving around every 25 to 30 minutes. So this is obviously very good for physical reasons, and I'll explain that why. But there's also a concentration mental research that they've done. It's called the Pomodoro technique. I don't know if any of you guys have ever heard of it. You can Google it. What it does is the idea is to break down all of your tasks into 25 to 30-minute time blocks. So especially if you have something that you're not really doing, especially if you have something that you're not really interested in doing, this gives you, okay, I'm just going to stick with it for 25 minutes, and then when I'm done, I'm done. So for concentration, but also physically. So when you're in that prolonged sitting position, how many of you, and I can't see your videos, but I was going to ask for a raise of hands, but how many of you start to get tightness after a certain amount of time, whether 15, 20, 30 minutes at a time? I know I do, certainly. So when you get that tightness, it's kind of like your brain is giving you a little knock on the door. It's like, okay, if you continue in this position, you are going to start to do damage to your body, your muscles, your tendons. So that's what tightness is. It's kind of like your gas light coming on. So you really want to pay attention to what your body is telling you. If you continue to push through that, it's going to knock harder. And the way it shows you how it knocks harder is you get more pain. And it takes a longer time for that pain to subside as well. So really listen to your body. So when you start getting that little bit of tightness, that little teeny knock on the door, stand up. So even if it's for 10, 20 seconds, what you do is it's changing the input into the brain and the nervous system. So the muscles, when they get that input, they're like, oh, okay, she's listening, and they back off. So that's really important. Set a timer. If you start to get pain after 15 minutes, set your timer for 10. Even if you're standing up or at a standing desk, you can do some activity to kind of move things around. So what I want everybody to do right now, if you have some space to stand, and hopefully you'll get to see, I want to go over just actually really one of my favorite activities to do when I'm at my desk and I take a break. So luckily I have my desk at home, and right behind it is my Buddha and my yoga mat, so I can kind of do my stretches kind of as I'm doing that. But what I want everyone to do is stand up. Okay, so the idea is to get more joints involved in a movement. So, I'm fine with the basic stretches with your wrists, elbows, but the more joints you get involved in an activity, the more input you're going to get into the brain. So there's a study that they did that they had, I don't know how they gave monkeys carpal tunnel, I don't even want to know, so they had them do just basic exercises like this, and then had them do gross movements with the wrist and the elbow and the shoulder, and those tendons that healed a lot faster. So anyways, okay, so go ahead and stand up. What I want you to do is you're gonna have your arms crossed in front. Also crossing the midline helps. It gives more feedback into the brain because of the left and right hemispheres of the brain. So cross here. You're gonna come up, take a deep breath in. Open, expand the chest, maybe even look up a little bit. And then as you exhale, come down. I'm gonna bring my screen down just so you guys can see me. You're gonna come down and squat, cross your hands, and touch your toes. Touch your opposite hand to opposite. And then come back in again, deep breath in. And exhale. So that really gets all the joints moving. I really like that one because it works on opening the chest up, which is really important because we're like this all day. So it's important to take breaks here. If you really just have tightness in your chest, you can just work on opening the chest that way. Okay, if you can see that I'm out of breath now. I need to start exercising a lot more. Okay, so if you have time, go for a walk. Just whether it's a walk around your office, a walk around your house, a walk around the block. I know Mary, who's on the call, she was setting a timer for 25 to 30 minutes at her work, and what ended up happening is she would just, after 25 or 30 minutes, she would go and hop on the treadmill. Of course, we're a PT clinic, we have treadmills. Oh wait, here, I'm gonna admit somebody in the waiting room right here. All right, so, and she was getting up every 25, 30 minutes to walk 2 to 5 minutes. So that's something you can also incorporate. I highly, highly recommend that, not just for your physical body, but your brain as well. Okay, so if you have pain and it's getting worse, listen up. All right, so we talked about tightness and tension. Tightness and tension are the first signs of postural dysfunction. So this is like the gas light coming on, pull over and get gas. Like, you need to address this. So even before tightness and tension happen, there are physiological changes going on, and we don't know about them yet, right? Because there's a big window there that our body modifies and adjusts, and that's the beauty of the human body. But once you get tightness and tension, something's already up. Okay, so what I would recommend is kind of 2 avenues from there. If you have tightness and tension, first signs of postural dysfunction, make sure you're doing stretching, like every 20 to 30 minutes, getting up, doing that stretch that I showed you. You know, just gentle side bending activities here to get the, just to stretch the muscle. If that doesn't make it go away, it's time to act and make a change. So that's where we come in. So if it has gotten worse, what do you think will happen 3 months from now or 6 months from now? So if you started with this tightness, let's say 6 months ago, and it hasn't gotten better, it's actually gotten worse, the more you input into that system, more joints are going to get involved. So we know medication is lovely, and it kind of gets us through the day, but it's a Band-Aid. It's only fixing the symptoms, not the actual cause of the problem. And then you start having other joints that get involved. I can't tell you how many people I treat that have, you know, that forward head posture, neck pain, and then they start getting TMJ because they're sitting at the kitchen table and chewing and eating like that repetitively, right? Their jaw is not in the right aligned position. So then other joints start becoming involved. So I want to go over what successful treatment looks like. So with physical therapy, you know, there are definitely lots of different types of physical therapy. Manual therapy, this is my favorite thing to do on someone because they love it so much, and it's my favorite thing to get done on me. What we incorporate a lot in Magnolia Physical Therapy is manual therapy. So this is where we go in and we actually address the restriction, address the tightness of the joint or the muscle. A lot of times, you know, if someone has this forward head posture, these muscles get so tight that stretching doesn't really affect it. We have to get in there with our hands and loosen it up and get the joint moving again. Stretching, of course, we talked about that. It's very, very important. The muscles get tense. When they start getting overloaded, they start to tighten up. You get tightness, then you get burning, and then that leads into pain. So stretching is super important. Something we do here at Magnolia is the unloading therapy. So we talked about the weight of your head being 8 pounds, and it's constantly on your neck. So what we do is we take a certain percentage of your head weight, put like kind of a traction, and then we have the patient exercise and do an activity that way. So what it does, it takes the load of the head off of the neck, and when you're moving your arms, it kicks in all the stabilizing muscles there. So that's kind of the thing there. All right, so, and I'm going to take questions in a little bit, but what I wanted to offer here is we're doing a virtual free online pain relief assessments for everyone that's on this call or everyone who's signed up. So if you want to schedule your free pain relief assessment, I want you to do this. Okay, you could either write this down, magnoliatherapyla.com/request appointment. I'm going to click on this so I can show you what to do. Or you can call us at this number. If you have access to a computer, the request is a little bit easier, but you can also call here, 504-228-4882. And then I'm gonna go to Magnolia. Let me just show you what to do. These are all of our doctors of physical therapy. We're missing a couple here because I couldn't fit them on the page and I didn't have a recent picture of Brittany, but we have 8 doctors of physical therapy that can do your free pain relief assessment. What happens in the free pain relief assessment is we're scheduling them online. You can also come into the clinic if you're comfortable doing that. Is the therapist will get your information, get a history, what's been going on, how long has this been going on, analyze your movements. They'll have you do all different kinds of movements with your neck, your head, and then assess the mobility of your joints and your muscles. So the strength of your muscles and also how tense they are, but also the mobility of the joints in the spine. And then they'll let you know, okay, this is just do this stretch and you'll be fine. Or look, you're really in a shortened position and physical therapy is gonna help you. So I'm gonna go to this site right here. So you guys can see what this looks like. Okay, so this is our online request an appointment. So you're going to click here, request appointment, and then you're going to fill everything out here. Okay, so once you fill that out, someone will call you and we'll get you scheduled. I'm actually doing the virtual pain relief assessments this afternoon. I've blocked off my schedule after this, so anyone who wants to schedule then with me can do so. You just have to fill this out. So put your name, phone number, all that good stuff, or call the number listed below. And then we'll go from there. Okay, let me get back here because I know we probably have some questions.
Before COVID, at our March meeting.
Let's see, Kelly?
Yes.
Do you want to go over some of the questions that we had?
Okay, so far, our Cox 1 would like to know, she writes, I stand at my desk most of the day, even at home. What's best as far as eye level? Should I be looking directly at the screen or looking down at the screen?
Yes, looking directly at the screen. So standing and sitting, same rules apply, except for, of course, the bend and the 90-degree bend. What I would suggest if you stand at your desk most of the day is, I'm going to bring my screen down just a little bit so you can see my hips. Okay, so when we stand, some people stand arched. Let me bring this a little bit up. So with an arch in their back, and we call this like kind of hang on your hips here. So what I want you to do is I want you, when you're standing, is to kind of tilt your pelvis forward and back, the full range. So kind of bring it in, make your back really flat, and then arch. And I want you to find somewhere right in the middle that feels comfortable to you. And that's your pelvic neutral. That's where you should be hanging around when you're standing at your desk. So make sure that you're in pelvic neutral, and also same thing with your eye level. Your screen should be a little bit higher. Like I'm actually looking down right now, so my screen should be a little bit higher, but I wanted to make sure you guys saw me and all this moving around and stuff. So hopefully that answers your question. All right, thank you so much. All right, we'll get to the next question. Just a reminder, anyone still left on the call, to go to our Magnolia Physical Therapy page, request your appointment if you want a free virtual pain relief assessment by moi this afternoon. So make sure you let me know that. Okay, any more questions, Cal?
None that have been typed in yet, but Mary was talking earlier about tingling in her.
Oh, right. Okay.
So maybe address that, neck pain and tingling fingers.
So what happens when you get that pain that goes down the arms, and it could be the legs also. With the arms, what's usually going on, unless you have, there's a possibility you might have a compressed pinched nerve here, but that's not always the case. People, they get pain down their arm and they think immediately, I have a herniated disc or whatever. That's not always the case. Especially if you get that when you're sitting for prolonged periods, what happens is when you start sitting, your body gets tired, so your upper traps start to hike up. How many of you have ever noticed, like, you're at the computer and you're like, oh my gosh, my shoulders are in my earlobes, right? So you come here, so then all these muscles get tight, and then the brachial plexus, which are all the arteries and nerves that come out of your neck, come down and into your arm. They kind of spread out like this. So when you're tensing all of this up, you can pinch or compress any one of those arteries and nerves. That gives you the tingling. So the tingling could be from lack of blood flow, but it could also be from a compression of a nerve as well. Okay, thank you, Mary. All right, does anybody have any other questions? I'm gonna kind of unmute everybody, so if you guys wanna pipe in. If not, that's totally fine. I'm gonna send a copy of this webinar to you guys so you have it. I'm gonna stop sharing my screen, and then we'll go from there, get back to my thing here. Okay, perfect. All right, let me get all you back on my screen so I don't see anybody's faces, but that's okay. I see some familiar names. So, okay. So let me know if you guys want to schedule the screen. You're going to get a free copy of this webinar so you can go back and look at it anytime. Feel free to share it with anybody that you think it might be beneficial. And then any thoughts on something that I didn't cover that you wish I would have covered, or anything like that, please write in the comments section and let me know. This is my first time doing one of these webinars, so I hope you found it informative. And I hope to see you for the virtual pain relief assessments this afternoon. So again, let me see if I can share. Kelly, you want to say that phone number again and then our website?
I will. It's 504-228-4882. And I'm going to copy this, I think. Let's see.
Oh yeah, put the link in the.
Put the link right in here that you can go and schedule yourself for the free screen, whether that's virtually or in the clinic, either way. But if you want to do virtual, we can do that, like you said, right after we're finished here today.
Perfect.
Beth, I have a question. Can we get a copy of that stretch you showed us, the ones that attended the webinar today?
Oh yeah, for sure.
Cool. Thank you.
You got it. All right, any other last questions before we sign off? All right, I appreciate everybody joining me, and I'm going to be doing more of these webinars. The next one's going to be on specifically for sciatica and low back pain. So be on the lookout for that. If you are interested in that one, let me know. Write that in the chat section. We'll make sure we get you on that list. Other than that, have a happy Wednesday. Hopefully I'll see you all this afternoon.
Thank you.
Bye.
Okay, our Cox is interested. Okay, cool. All right, so I will stop recording.